meeting and hear everything that we're saying, discussing in the meeting, not just on TV. That would be my interpretation of it. Again, I'm not legal counsel, but I would advise us to heed their advice on that subject matter. That makes sense.
I mean, we can check with them, but we can definitely check to see whether viewing it on RCTV is adequate for them to
public meetings are very specifically protected. That's the only.
Is there anybody in the waiting room right now?
No.
Okay.
But we can certainly let people in, and Heather, you have the ability to stop them from being able to share anything, or even turn the camera on. I know you have the ability to keep their mic off. You have the ability to keep their camera off as well.
I think so. I'll double check in the settings, but I'm pretty sure I can.
I would say that would be a good policy until we figure out what's going on, is keep their camera off, keep their mic off, and allow the admittance, because again, public meetings are very protected.
Right, but I don't think there's a whole lot of difference between being on the meeting with your video and audio turned off and being in a waiting room where your audio and video is turned off.
You have to go to a television to see what's going on with the meeting. You're not seeing the meeting. That's the problem.
Yeah, if they're in the waiting room, they can't see what's happening in the meeting.
Right.
Someone's gonna have to tell me offline what the heck happened. So what I do is
pornographic
log in.
And,
I log in and then I walk away, because there's always updates that need to happen and this and that. So well, it looks like I'm there. I'm not there until you see me. So someone's gonna have to tell me what the heck happened. Okay.
Okay. So let me call the meeting to order. And I don't know, we lost Jerry. She was there, but so Kevin.
Here, Kevin Sexton.
Joan.
Here.
And Rick Lopez here. So our agenda tonight is relatively light. I'm going to review the minutes and then public comment if anyone comes back. And then the items, 5, 6, 7, 8, and 9 are really all updates and informational. There's no votes or other things that are planned. And then final comments. I think that we're going to revisit the wildlife feeding, but that's still being reviewed by town council. So we'll do that, maybe the next meeting. I think that was the only outstanding item from the last meeting that we expected to have. So with that, people got the minutes from our last meeting on February 13th. Looked okay to me. Any comments, suggestions, edits?
Good to me. And it was just as a comment, I will say it definitely read a lot better than I think the previous ones. It didn't read as so jagged AI as the ones before that. So I think whatever changes were made, it was a really good change. And maybe no changes were made. I don't know.
Okay, then I'll make a motion to approve the minutes. Do I have a second?
Second.
Okay, roll call. Kevin?
Yes.
Joan?
Yes.
And Rick, yes. So the minutes are approved. And Haley, I don't see any public on, and there's no one in the waiting room.
No, there's nobody in the waiting room.
Okay, so we can move on from that. MBTA turnaround update.
All right. I'm trying to compose myself, trying to recover from everything that happened. But yeah, I'm just gonna give some background information about the MBTA, some backtracks, and give an update. So as you all know, we've received multiple complaints, about potential health concerns regarding the MBTA turn back tracks. As a result, we reached out to the MBTA to inform them about the complaints and the concerns. And we also asked them to conduct a health impact assessment and an environmental impact assessment prior to commencement. MBTA stated that they're not required to provide either of those assessments, and they also told us that they will address the health concerns at the February 25th meeting. So I was at the meeting. They talked about it, but they didn't really address the health concerns. At the end of the day, they pretty much withdrew their notice of intent. And the reason was that they wanted to gather more information and listen to the concerns of the residents. So the NOI has been rescinded, and they plan to, refile it at a future date. I don't have any update in terms of when they plan to refile, but as of today, I'm not aware of any new filings. And, as a result of this new development, we paused the request for quotes until further notice. We're hoping that the new notice of intent will include a health impact assessment proposal. But if we don't get that, we will resume the RFQ soliciting process immediately. So that's where we are at the moment.
And it could be that either the MBTA doesn't come back with that proposal, or they adopt an alternate proposal. And so we just have to kind of, I think, wait and see what they're gonna do.
Correct.
So, my concern is timing. Dave, do we have any sense of, I know we don't have any sense of cost, but do we have any sense of timing for what an RFQ would produce from contract to report?
I would say, well, to execute a contract will be between 2 to 3 weeks.
Okay. And then a report, do we have any? I know it's such a, like, not unusual report.
With the report, based on similar situations that I've witnessed in the past, I would say not more than 6 weeks.
All right. So the only thing that concerns me is, again, I brought this up at the last meeting. They're on the no authority to just even let us know they're doing it. And I'd almost rather err on the side of having a report in the back pocket rather than needing to go out to do it. I'd keep it. If we put out an RFQ, do we need to execute it? In other words, can we rescind it after we see what the costs associated with it are?
Yes.
We can, yes.
I'd rather do that. I'd rather see if, to use a term I love to use, if the juice is worth the squeeze. Is it going to be cost effective, or is it going to be through the roof where it's like, well, no, maybe we should pause it since this may not be a good thing to have in hand because they may change their tune down the road and we just wasted a ton of money. But I'd like to have that option. I'd like to see what it is we're getting. Because ideally in a bubble, I'd like to have the report in the back pocket.
I would have to discuss that with town management.
Okay.
And go from there.
Again, I'm just looking to see, what does it come in at? What cost are we talking about?
But from my perspective, they may not come back with the, number one, they may not come back with the exact proposal. Number two, they clearly were impacted by public comment and pushback. And so I rather doubt that they would not give notice. In fact, not actually plan a better public relations plan than they did the first time around. And my guess is that given how things work with the MBTA and even in this recent event, I mean, it took them from the time they announced it to the time they were planning to do it was several months. So I think we were talking about $6,000-7,000, but it could be, just either not relevant to what they come back with, if they come back with anything at all. So I don't know. A day you should talk to Matt about it and see what he thinks. I'm not entirely convinced that, necessarily just going ahead with it, even if it's not that expensive, it may just be wasted if, what they decide is not compatible with the charge we've given the consultant to evaluate.
Correct. I believe the consensus was to wait and see what happens. Regardless of what happens, between the time we execute a contract and, get the report, we'll have everything done before they get approved and before they get started. So.
Well, I'd hope that's going to be the case, certainly, because they've already done some due diligence. They're already kind of, pun intended, they're already down the tracks a little bit here with what they're doing. So again, it's just a concern of mine. I'm willing to put boulders on the tracks to prevent it from happening at the time when it comes to get our report in. So fine with me either way.
Okay. We can check on that. So Dave wrote an update.
You see my screen?
Yeah.
Yes.
Okay, so at the last meeting, we went over the rodent control program, talked about the procurement of the 15 smart boxes using the remainder of the ARPA funding. We also talked about, going to town meeting to ask for additional funding to purchase 35 additional smart boxes. We talked about how the smart boxes work and how the heat map is generated. We talked about how to navigate the heat map, and we also talked about creating a rodent specific page solely dedicated to rodent control that is readily available and easily accessible by the residents and whoever wants the information. Tonight, I am pleased to announce that we now have a rodent page dedicated to activity in the town of Reading. There are multiple ways to access this page. Let's see. So if you go to the health department homepage, all you have to do is click on this icon right here, this beautiful icon, and it takes you directly to our rodent summary
Report rodents.
data summary page. Another way to access this would be the tabs on the side. Just click on pest control. Scroll down to rodent activity and then click on rodent data summary page. So there are two ways to access this information. All right, so here's the heat map we talked about the last time. We went into details about it. As of right now, we have 38 total rodent captures. So the breakdown of that, we had 11 in January, we had 22 in February, and we have 5 so far in March. See, you can also click on the individual monthly tabs to get, some more details about, how many catches or captures we had within that month. And what days. So for example, if we go to the January tab, we had a total of 11 captures, and we can just, quickly count. So on January 18th, we had 3 captures. January 19th, 3 captures. That's a total of 6. January 20th, we had 1, total of 7. January 25th, we had 1, total of 8, 26 to 1. Total of 9, 27, 1, total of 10, and 28, 1, total of 11 captures. Also, we have rodent sightings, complaints from the residents. We only received 1 complaint in January and 1 in February. And then if you scroll up, the residents can click on report rodent sightings, and then it takes them to a different page where they can report the sightings, and we get that information directly.
That's a nice improvement. I think one of the Pineville residents commented on that there wasn't a rodent-specific way to report. You had to kind of go into this general complaint fix-it thing. And so this
Correct.
it's a nice improvement.
Correct. Also, you can click on the rodent action data. It just gives us more details about, the quantity of captures and the individual smart boxes that captured each rodent. So yeah, it is looking great. I'm happy we were able to get it done. Here we are.
That's great.
Hopefully in April, I'll be at the town meeting. I'll, try my best to advocate for this program and see if we can get additional funding. In the meantime, I am in talks with DPW. That time of the year is around the corner. You're going to start seeing excavators and, road pavings and things like that. So we want to make sure we're ready this time around. So I am in direct talks with DPW to see how we can mitigate any, rodent issues during the paving process and excavation process. So I will keep the board updated as we move along. So that's about it.
Good. Thank you. Looks good.
Okay.
Come a long way. Any
Yeah.
comments, edit, any suggestions or?
Just one quick suggestion today. I don't know if we have the folks on Pineville's email addresses or contact information, maybe just to send them the page so they have it.
It's a good thing. Good
Yeah, we
idea.
can, but I'm sure they're watching. But yes, absolutely, we can.
Thank you.
Thank you.
All right, fee schedule update.
All right, I'll try to make this as brief as possible.
Dave, for the viewers at home, can you blow that up a little bit, please?
Let's see. Don't believe I can. Yeah, I don't believe I can.
Actually, the plus sign at the top of the page.
Oh, yeah. Let's see.
Just there.
This is good enough.
Yeah,
One more,
One more. Let's see.
please. Perfect.
All right.
Thank you.
You're welcome. Okay, so we pretty much looked at fee schedules from neighboring towns, and we took an average to determine what our fees will be. Amelia played a crucial role with getting the information and the data set needed. So I really want to thank Amelia for helping out. We looked at North Reading's fee schedule. We also looked at Andover's schedule. We looked at Winchester, Linfield, North Andover, Beverly, and Stoneham. And here is our proposal. here's what it looks like. You know, the board has this information. You guys can review it and vote on it at a subsequent meeting. So I'm just going to go over it quickly tonight. And, you know, if you have any comments, we can always go back and make changes. All right, so if we look at the food section, we have the new establishment plan review and the extensive renovations. Currently, it's at $150. We're bumping it up to $200. The minor renovations and residential kitchens, currently at $50. We're bumping it up to $100. The initial application for a residential kitchen is at $50. We're going up to $100. And residential kitchens, including B&B and continental breakfast, we're going from $25 to $50. So food services, in terms of like your regular restaurants out there, from 0 to 50 seats, we're keeping it at $100. From 51 seats to 100, we're going from $150 to $200. From 100 seats and up, we're going from $200 to $300. We don't have any shared kitchens in Reading at the moment, but we had an inquiry, so we're trying to be proactive. We know that eventually we're going to get one in Reading. So at this moment, we don't have a fee for it, but we're proposing a $300 application fee for that. If you have a food service establishment and it fits into one of these categories over here, you pay that fee. But if you're also a caterer, you pay the additional $100. So it used to be $25, we're bumping it up to $100. If you're just a catering establishment alone, you're going from $100 to $200. Frozen dessert license is going from $40 to $75. And the temporary event license, which is valid for 14 days, is going from $25 to $50. Mobile food trucks, we currently have them at $75 and then $25 for additional mobile units, but we're proposing $100 and $50 for additional mobile units. Retail food services, you know, like the market baskets and, you know, gas stations, Stop and Shops. So if you're like 0 to 900 square feet, we're going from $100 to $200. And 901 to 1500, we're going from $100 to $300. 1500 to 4000 square feet, we're going from $100 to $400. And 4000 and up, we're going up to $750 from $100. So as you can see, you know, anything related to like retail food services is at $100, regardless of the size of your establishment. It takes more work to inspect a 9,000 square feet, you know, retail food service compared to a, you know, 900 square feet retail food service. So let's see, reinspection fees for food and retail services. Typically the first reinspection is free. So if we go out and perform a comprehensive inspection and we identify violations, and then we tell them, hey, fix these violations. We're going to be back in 24 hours. We're going to be back in a week. We're going to be back in 30 days. Whatever it is, the first reinspection is usually free. Now, some establishments, you have to remind them, you have to go back the second time. We've been doing it for free, but now we think bumping, you know, having a $50 fee associated with that would help pretty much prevent us having to go out multiple times. If we have to go out the third reinspection, it used to be free. We're associating a $100 fee. Fourth time used to be free. We're going up to $150. And then if we have to go out after that, we're just going to refer them to the board for possible revocation or suspension of their license. In terms of animals, keeping of animals permit, currently the initial permit is $10. We're proposing $75. For renewals, it's still $10. We're proposing $30. additional chickens. So the maximum is 6. If you request a variance that you want to keep more than 6, then you have to pay for additional chickens. We're not gonna, continue to charge you, the same $10 if you're keeping 6 compared to if you're keeping 20. That's not fair, for our inspectors. So we think, we should pay something at least. And for stables, we're charging $40. We're trying to bump that up to $50, and then additional $25 per stall. For body art establishments, the plan review is currently at $500. We're keeping it at $500. And the establishment permit application is at $200. We're bumping it up to $300. For the practitioner's license, we're going from $100 to $200. And for the apprentice license, it is $125. We're keeping it that way, but based on our current fee schedule, we don't have any amount associated with it because it's a new program that we started like 3 years ago, and this fee schedule has not been reviewed for, I'll say, at least a decade, if not more. For ice rinks, we're going from $50 to $100. That's for the ones indoor. Outdoor, we don't have any fees associated, but we're proposing $150. For recreational camps like YMCA, they're currently paying $10 for their permit. So we're proposing to bump, them up to like $50. And it's not just YMCA, it's just for all camps. And I'm just saying YMCA because, YMCA is big and the permit is $10. And then if you have a 2-week session, we're proposing a $100 application fee, and then a 3-week session or more, we're proposing $150. For the swimming pools, currently we don't have any fees associated with the plan reviews. We're proposing a $200 fee for swimming pools and special purpose pools. Indoor, we're bumping it up. Matter of fact, we're keeping the same amount. We're keeping it at $150. And then for the outdoor pools, we're bumping it up from $75 to $100. For the tanning establishments, we're going from, let's see, $25 per bed to $50 per bed or both. We're keeping the initial fee of $100. And then for the annual fee, we're going to $50 per bed or booth as well. It used to be $25 per bed or booth. For tobacco establishments, sale of tobacco, we're keeping it at $200. For the smoke shops, we're keeping it at $200. Well, construction is staying the same, $100. Lodging, we don't really have any hotels or motels, in Reading whatsoever. It's currently at $8 per room, minimum of 24, maximum of 160. We're just going to do hotels for $100, motels and shared rooming and B&Bs for $50, and at $10 additional per room. And then disposal, construction permits for septic systems, we're going from $50 to $150. Installers license fee, we're going from $50 to $150. To do a repair, we're not charging anything at the moment, but we're proposing $100. For septic abandonments, we're charging $50 at the moment, but we're proposing to go up to $100. Portable toilets, we're going from $25 to $50. Let's see. Dumpsters, currently, if it's less than 2 yards, we're not charging anything, which is ridiculous because a lot of people just get dumpsters that are less than 2 yards and just not pay a fee. And then if it's greater than 2 yards, it's $40. So right now we want to eliminate the less than 2 yards. If you have a dumpster, you have a dumpster. Doesn't matter if it's less than 2 yards or greater than 2 yards. And we're proposing $100 fee for that. If you get any temporary dumpster, we're proposing $10 addition to the $40, making $50. So for all our permits, first reinspection, it's going to be free, $0. If we have to go out the second time, it's going to be $50. If we have to go out the third time, $100. Fourth time, $150. And if you're still not in compliance, we're going to refer you to the Board of Health for a possible revocation or suspension of your license. All right, in terms of weights and measures, balances and scales, we're going from, if it's over 10,000 pounds, we're going from 150 to 250. If it's between 5,000 and 10,000, we're going from 100 to 150. If it's 1,000 to 5,000 pounds, we're going from $75 to 100. If it's between 100 pounds to 1,000 pounds, we're going to keep it at 50. Greater than 10 pounds, less than 100, we're going from 30 to 35. 10 pounds or less, we're going from 15 to 20. Let's see. In terms of retail scanners, for price verification, if you have 1 to 3 registers, we're going from 75 to 100. If you have 4 to 11 registers, we're keeping it at 200. And if you have 12 plus registers, like a Stop and Shop or Market Basket, something similar, we're going from 350 to 500. Let's see, and we want to keep our minimum charge at $25. So yeah, that's pretty much it. And you guys, the board has the document. You can review it, and if you have any proposals or changes you would like to make, we're open to doing that. And once it's finalized, I can send it to town council to look over and then go from there. Any questions?
I just have a few questions.
Yeah.
So in regards to the re-inspections, my questions are really more structural. I don't have a problem, I don't think necessarily with the dollar figures, although I reserve the right to change my mind on that. But when we do a re-inspection, what's the time limit that we give before we'll come back out for that? In other words, you go out, you inspect, there's an issue, we're going to come back in X, is it like a set date, X amount of days?
It depends on what the code tells us to do. So if it's something that's critical, we always encourage them to correct it on site. If it's something that cannot be corrected on site, it's a 24-hour violation. They have to fix it within 24 hours. If it's critical but it's not detrimental to health, then yes. So for example, if we go in and they have a cooling unit that's not keeping temperature, even though they can't fix it right away, we ask them to remove the food and put it in a different unit that's meeting the required temperature.
Okay.
So that's one of an example of fixing it on site. And then they can have the technician come in and fix that particular unit. And, we work with them to get it done. So it just depends. If it's a missing tile, the code allows us to give them up to 30 days. So it just depends on what the violation is.
Okay. So this isn't, you must fix your refrigerator in 24 hours. You must just refrigerate this food properly within 24 hours. I have that
If it's
right?
the food, you must refrigerate this food properly, like right away. It
Right
depends
away,
on
okay.
how long it's been out there. If it's been below temp for a long time, then we have them discard the food.
Sure. So
it's still at the right.
Yeah, the only reason I asked the question a day is my only concern with something like that would be that we're not giving them sufficient time to fix the issue, and we're just going to start fining them as a result of it, which I know is not the intent of your department.
Yeah, we are very reasonable over here.
I know you are. I know you are. So here's what I always say, in regards to things like that. You are very reasonable. Amelia, I don't know that well, but I'm assuming she's very reasonable as well too, because she seems very
Absolutely. Absolutely.
what happens when we put things like this in place though is then, 30, 40 years down the line when there's new folks in charge, and I'm saying that as a pretty far-fetched out there from a date standpoint, but I always want to make sure that we have something in place that is understood for future staff to be able to use correctly. Does that make sense? So, in this regard, as long as we're giving them the option to fix it in the time frame, so we don't have to find them, I'd hate to have people working hard to fix the issue and then we're finding them. Is really the bottom line. Does that make sense?
Yes, it does.
Okay.
Amelia, are you trying to say something?
Yes. So the way I look at it is the reinspection fees, obviously I don't want to hand those out, but I look at it as a template for food establishments to understand that food safety is the #1 priority. So that is for them to view food safety, that we take it very seriously. And trust me, I don't want to go reinspect something 3 or 4 times, because obviously we have we have a million moving parts at the same time. So the reinspection fees are kind of, I don't know how to word this, but it's a way
Deterrence.
for us.
The deterrence.
Sorry.
A deterrence, like to deter.
Deterrence, yes. I'm so sorry. Yes, a deterrence of them to also wanting a reinspection. So I look at it as a way for them and us to know, like, hey, we take food safety very seriously. We could go down this avenue. Obviously, we don't want to go down this avenue. They don't want to go down that avenue. So it just kind of puts in place, like, almost like a check and balance of food safety and proper food safety.
Yep.
And I worked in the last town I worked in, we actually had reinspection fees. And did we hand out like a $50 ticket? Absolutely. But it really did never get to a point where we had to go back 3 or 4 times and hand out like $100, $150. And the establishments, knowing that that was in place, they also didn't want to pay a fine ticket like that. So we saw food safety being taken more seriously at a higher level than, without having that. It's just, again, that check and balance of, are you doing food safety properly? And if you're not, there are repercussions for it. But again, we're very reasonable. I love working, with the restaurants and giving them the ability to correct things on site. I'm like very for that. So if I see things that are quick, like correct on site, I love putting those on reports. So, but I understand your concern as well. Like in the future, like 40, 50 years from the line, if we're not here, are people going to abuse that reinspection fee? Fingers crossed that they won't. But maybe if there's a way that we can like educate people better on the purpose of a reinspection fee, we can definitely do that, just to ensure that that doesn't happen.
No, thank you for that, Amelia. And I'm with you. I have no problem, quite frankly, with the fees at all. And especially if they're warranted, then absolutely. That's, like you said, it's both a deterrent and a slap on the wrist, so to speak, for future deterrence, right? From that establishment. So I am definitely in favor of the fees. My only point in case would be, we recently just went through this, and not on food inspection, but on even the general inspection permits that we have, where things could not be satisfied in the time. And, it's a long way of saying their recourse, for that matter, was to come before us to try to get extensions to those, the timelines of which they had to have it done by, right? And so there's a mechanism. I acknowledge that there's a mechanism for the individual to be able to come before us and get those fees not waived, but the timelines for them to be reinspection done extended. I just want to make sure that that we are working to not have to have those fees imposed on folks, and we're giving proper time to, I'd rather not have a ton of people coming before the board every month, looking for waivers, looking in regards to these fees.
That's not gonna.
Okay.
No, that's not gonna happen. Yeah, no way. No, this is just gonna serve as a form of deterrence to people. Again, we don't want to have to go out 3 or 4 times. The time we're spending to go out to the same establishment 3 or 4 times, we could be doing something else at a different establishment.
Yep, get it. 100% with that part. Yep.
Any additional questions?
So I had a couple. Actually, the first one, you kind of already answered, which was the context for the amounts in the proposed fees. I have no clue as to how these, generally work in health departments across the Commonwealth. And I was going to suggest, but you've already done it, which is to look at surrounding communities and, compare their fees with ours and then come up with new fees that are comparable. So I guess, couple questions on that line is the Commonwealth, the state doesn't provide any guidance around this. Is that true?
Correct. It's not like a standardized fee,
Okay.
every municipality.
And is it, and maybe, I don't know if Amelia did this or what at a high level, what was your approach to looking at 5 other towns and coming up with a proposed fee here? Did you use your judgment? Did you take an arithmetic average? What was your thought process in coming up with these fees?
So it was pretty much an arithmetic average. So the way these fees are structured, you won't find any of our proposals lower than anybody else's, fee schedule. And you
Okay.
will find it higher than anybody else's fee schedule. So we took an average. We looked at each towns, we did an average, and then we made our proposal. We looked at communities in our shared collaborative, and then we looked at other communities that are similar in size to our town to come up with these figures.
Okay, so we're not lower, we're not higher, but we're somewhere in the middle for all the proposed fees.
Correct.
Okay. The second set of questions was, I remember, I can't remember the context, but maybe the more direct question is, what is the process for getting these approved? Does the Board of Health have total control over this? Or is the select board the final arbiter? Or is there a town bylaw that rules what these fees, how does that work?
All right, so in terms of the details, I will get that information for you at the next meeting.
Okay,
This would definitely go to town council for town council review and, everything town council needs to do.
right,
And then I'll come back with that information at the next meeting.
okay. And at the next meeting, you'll let us know whether we actually have a say in this, other than, do we need to vote on this or not?
The board probably needs to vote on it. And I
Mhm.
believe the board has a say because this is a Board of Health permit.
Sure.
So,
And then lastly, I'm curious, how much income is raised for the town, like currently, in the fees we charge? And does that go to the health department's revenue line, or does that go to the general town bottom line?
it goes to the general fund for the
Okay.
town. And so when I first started, I did the math, and it was
Yeah.
around 75,000.
75,000.
And I remember, like when I first started, I told the
Yeah.
board that, we needed to increase these fees right away. But, I wanted to take my time to do that. I didn't want to come in and then impose fees on people, but I've been here now for 4 years and we've been charging the same amount.
Yeah.
I think it's time to do it.
Okay.
And things are getting expensive. There's inflation everywhere. If an inspector goes out to do an inspection, it costs money to do that. It's not $10. Like if you do a camp inspection, you're spending hours. If you go to YMCA to do the inspection, you're spending hours, and the permit is $10.
Right. No, I agree. They haven't been revised in quite a long time, so it's
Correct.
makes a lot of sense. I was just curious. This would probably at least double that 75,000.
Absolutely.
Yeah. Okay, so you're gonna come back to us after town council has had a chance to review it and elaborate on the process. And I think board members in the interim, when you look over this, if you have any, comments or suggestions, should get those to a day.
Absolutely.
Okay, great.
Just
Yes.
one suggestion on it, if I may. A day when you're proposing to get more money from town meeting in April, this would be a great document to provide as justification.
Absolutely.
Saying, if we're going to bring more in, it's nice of us to ask for a little bit of it.
Sounds good to me.
Kevin, you're a
Good
natural
advice.
politician. Okay. Community health improvement plan update.
All right, so I will give a small intro and then hand it over to Liv. Yeah, she's here smiling. I'm happy she's here. All right, so a brief background about this. We partnered with Peer Associates, which is a public health consulting firm, to conduct a community health needs assessment and also provide a community health improvement plan. The entire process started in February of 2023 and concluded in July of 2024. About a year and a half worth of work by the Board of Health, Peer Associates, municipal departments, and some of our community partners. The needs assessment and improvement plan document provides data about Reading's health status using a wide range of data sources and findings from interviews, focus groups, and surveys performed in the summer and fall of 2023. And based on the outcome of this needs assessment, Peer Associates was able to identify health priorities for improvement, as well as provide an improvement plan. The health priorities identified as follows. Number one, to prevent health screenings and treatment services. Number two, healthy environments and inclusive programs. And number three, healthy eating and active living. I will now hand it over to Liv, our public health nurse, to go over what we're doing as a town to address and improve upon these health priorities identified. Liv, take it away. As Liv is doing that, I just want to let the board know that she's going to transition into the monthly report as well and talk about the nursing updates first, and then Amelia will go after that, and then I'll go after that.
Can anyone hear me?
Yes.
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 Okay, perfect. Can you see my screen?
Yes.
Beautiful. Awesome. So as Ade said, we have 3 major priorities with goals in between, and I've categorized the PowerPoint to show our 3 priorities with the goals underneath. So without further ado, we have our community health needs assessment and improvement update with our health priorities. All right. So health priority agenda, those are our 3 priorities that Ade had said: preventative health screenings, healthy environments, and healthy eating. All right, health priority number 1, goal 1. Our goal, improve awareness and access to preventative health screenings and service for those in need of support. And through this, we would increase promotion and availability of preventative health screenings and health services in the community for residents of all ages, and address the leading barriers to healthcare and services among Reading residents. So in the last year and upcoming, we have done this through some of our wonderful events. In the past years and this winter, we've had hearing screenings, and we have promoted that through the Reading Public Library with the helps of our health librarian, Susan Beauregard, as well as our library administrator, Megan Clement, the YMCA with John Fudo, and the Town of Reading with our communications executive assistant, Josh Delane. We have the mammography van that has come in past years and coming this year as well. Actually, next month, end of next month. This is preventative for breast cancer, and we're collaborating that with the town as well as the Dana-Farber mammography van. I don't know if anyone's heard of MVP 2.0, Municipal Vulnerability Preparedness Program, highlighting vulnerabilities in infrastructure, society, and vulnerabilities in societal, environmental, and infrastructure vulnerabilities. And this is through the planning department, specifically Olivia Knightley, who has been coordinating that. And we also have the DEI implementation team that is being led by the Office of Equity and Social Justice, headed by Albert Pless. We are going to be starting listening sessions for sharing strategies to center marginalized voices and gaps identified during the Reading Equity Audit. This PowerPoint was sent out to all of you, I believe. Each of these down here are hyperlinked, so you can click and get to the MVP for Reading as well as the Reading Equity Audit. Furthering on priority 1, goal 1, we have our vision screening van, which it has come in last year as well as this year. We are already full on places for people to sign up for our Reading van this year, so that's amazing. Helping with ocular screening to see if individuals need glasses or prescription fixes. And then lastly, I do regular blood pressure screenings around town in association with the Town of Reading, the library, and the Frank Tanner Housing Authority. Okay, moving on to health priority 1, goal 2, supportive linkages to mental health and behavioral health services for those in need of support. And we do this through increased local capacity for triaging and bridging care to mental health and behavioral health services, and decreasing community stigma surrounding mental health issues, and to promote the importance of health and well-being for all. This has been a huge collaborative and really taking on by the Reading Coalition for Prevention and Support, also known as RCASA, or previously known as RCASA. This is headed by Erica Malay, as well as Jasenia Cruz, and our social worker, Tanya Jarzynecki. And they do a wonderful job with mental health in the community, as well as education on substance for our youth and our community members. These are a lot of things that I didn't know that Reading did, and I think it's really wonderful that we do. So we do have matchmaking for mental health. This is an interface that will pair you with a therapist that may be available via telehealth or maybe in your area. We have used it for 131 of our residents, giving them access to outpatient mental health providers. It's a wonderful service. We also have our critical incident management system, or CIMS, that captures the most critical information about incidents, referrals, and follow-up visits. And this gets sent directly to Tanya, and she's able to do an immediate action on residents that are in need of help. Crisis intervention team officer training. This is headed also by the coalition, and they do different trainings throughout the community to help with communication and engagement skills, navigating community resources, risk assessment tools, and collaborating with mental health providers. And then we also have our mental health first aid classes that are taught by our wonderful coalition practitioners, and this is training offered for adult and teen first aid. This is actually part of the 11th grade curriculum at Reading Memorial High already, and the Reading Coalition offers it to the public, and they are in the middle of a class right now, actually, an adults mental health first aid for adults, and it's a series that lasts a couple weeks. It's a wonderful program. All right, moving on to health priority number 2, healthy environments and inclusive programs, with goal 1 being to support the creation and promotion of healthy places, spaces, and programs for people of all ages and abilities. Identify new options and create plans and policies to support physical infrastructure for recreation and social engagement, as well as implement policy and environmental change strategies to improve code and ADA compliance in older buildings, ensuring accessibility for all. So we are doing this in 2 very specific ways. As I think we may all know, we've heard of ReCal, the Reading Center for Active Living. It's been in talks for quite some time now, since 2015. And that will foster health and wellness for promoting social interactions, strengthening the community, and providing a point of access to programs and services for all ages. I work very directly with our elder population and the Reading Senior Center, so I'm very excited for this specific goal to come to life. Yeah, a lot of good things that I think could happen with the ReCal. And then I just want to also bring us back to the MVP 2.0, which is specifically focusing on infrastructure, societal and environmental vulnerabilities, so they can really take the lead with our ADA compliance in our buildings, and that is through the planning department. All right, moving on to goal 2 in priority 2, increase opportunities for community connections and supportive services for those in need of support. So secure resources to expand the hours of operation for key town assets to increase accessibility for all. Increase the availability of adaptive programming to ensure inclusivity and accessibility. So we do this in a few ways. Our wonderful recreational department has some amazing programs that they do for our kiddos. So our special skates program, Learn to Skate program for children ages 4 and up with functional needs. It's an 8-week long program with volunteer instructors from the women and men's hockey teams at Reading Memorial. It's such a wonderful program, and I think it's really cool that all these different ages can come together. And different talents. And then we also have our rec trips. The Reading recreational team was able to host 4 trips last year with different events. These trips were for individuals 15 to 25 years old with functional and cognitive needs. Again, this was our wonderful recreation department. And as you can see here, they went to a Red Sox game. And from the reports that I received, they had a great time. All right, moving on to goal number 3 in priority 2, that is to build resilience among youth and young adults to foster well-being and belonging. Decrease youth screen time while increasing opportunities for youth engagement and enrichment programming. So again, kind of going back to the recreational department here, as well as the senior center and the library, 3 wonderful resources that are really trying hard to bridge that gap between generations, as well as getting kids out and about and doing activities. So we've got our intergenerational programs that are hosted by the Senior Center with the Department of Community Service. They do great things over there. They recently had a jigsaw competition, jigsaw puzzling competition, which is just so fun to watch. If you guys ever get a chance to head over there, they're really cool. And then they had a bingo night with a DJ, which I heard was just, it was a huge hit. And I think that's definitely going to be coming back. We have our Reading Recreation Division, which hosts some wonderful daycations throughout the year for kids of all ages. And I do believe I also hyperlinked this, and it'll take you directly to the program pages. And then lastly, our library has some wonderful events that they do monthly coordinating for children and teens. And that is coordinated by our teen librarian, Megan McCabe, and our reference and community health librarian, Susan Beauregard. 2 wonderful resources over there. All right, moving on to health priority number 3, healthy eating and active living. So goal 1 for this, increase healthy behaviors across the lifespan by making the healthy choice the easy choice. Create and disseminate prevention and health education messages to promote healthy eating and active living within the community. Increase access to healthy food sources within the community, and increase community walkability and bikeability to key destinations in Reading, such as schools, recreation, and facilities. promote and embed healthy eating and active living as a core priority for policy and systems change in Reading. So this is definitely something I have a passion for, and I want to expand upon this in my years to come here in Reading. I was able to start a little wellness series. This is going to end up being a 4-part wellness series, and we did our last talk in January, and I had 2 sessions at the library and then one at the senior center talking about healthy eating, exercise, and rest with a focus on diabetic nutrition. It went over really well, and the residents that I talked to said they really appreciated it. And then I just also wanted to bring attention to the Reading Food Pantry. It's a nonprofit Reading food pantry established in 1983, providing food assistance to families who live in Reading. We currently serve 400 plus households across town, operating out of the Old South United Methodist Church. And then they gave a nice little description: the big white church facing Reading Town Common at 6 Salem Street. All right, and that is actually the end of that assessment, which you should all have a copy sorry. Are there any questions before I move on to my nursing update? Nope. All right.
I have a comment. So
Beautiful.
we thought this would never happen because in most towns, when they provide a community health improvement plan, most towns they don't have the resources to execute the recommendations in the plan. But it appears that we have that in Reading, so I'm really happy about that. And I'm also happy that you put everything together. Initially we were kind of confused. We wanted to get a steering committee to help us get all the information and put it together, but you made it possible. So I really want to thank you for doing that.
Oh, thank you. I appreciate that. Thanks, guys. I'm blushing. All right, wonderful.
Can and I would second what Ade said. I mean, I think you've done a great job. And I think it's important for us to, as a board, as a health department, to continue to kind of track how we're doing around these goals and objectives. And I had talked to Ade about, maybe quarterly or on some regular basis to kind of have an update to the board so we know we're moving in that direction. Do you have a sense that a number of these organizations that you pointed out have knowledge and understanding of what our community health improvement plan is and how they fit into it? I know they're all doing their own thing, but do they sort of understand that this is actually, from our perspective, part of a bigger plan to improve the health of the community?
So I think that's a wonderful point, Dr. Lopez. I definitely think that in the conversations that I've been having, that basically what I've been trying to do is find these different resources throughout the town and see if we are already doing that in some way. And then when I do, I'm just trying to bring that information together with those people and be like, we are collaborating together. We should work together. We want the same goal. And that is usually very well received, but a lot of people don't realize that we have a whole chip out there already with these goals in mind. And I'm trying to bring that attention to the forefront of their mind. I'm trying to bring that to their attention, and establish these relationships that, or reconnect these relationships so that we can do this together. Because I don't think one department alone can execute this whole plan. I think it needs to be a town-wide collaborative between pretty much every department.
Right. So I definitely, I think that's the right approach. I think it's important to educate all these other entities about what we're trying to do, and also to encourage them if they want to do or are thinking about other activities or initiatives that are consistent with our CHIP goals, that you would want to, be part of it and help
Yeah.
work towards it. So it encourages them as well.
And
So-
to your point, I actually just got an email this week asking the library asking me if I wanted to host something that would be a community engagement program. So I do think that these relationships are benefiting us and will continue to benefit us.
Great.
Okay, let me just pull up my notes here and my other PowerPoint. I love PowerPoints, in case you haven't noticed. Okay. Oh no, hold on. I have to stop sharing again. I'm not 100% sure how to put this in presenter view. But it shouldn't matter. Is everyone able to visualize this okay? If I was to just scroll through it?
Sure.
Okay.
Click on the plus sign to see if it gets bigger. Like it's near the O.
Yeah, I think that's just to add people to access the.
It's actually down at the bottom. It's a little slide bar
Yes,
yeah.
right.
Yeah, right there. 1/8. 1/8.
to the
What?
left.
To the left. This one? No,
That's
1/8.
Yeah.
Yeah,
There we
that's
go.
right there. Yep.
There you go.
Okay. Let's go a little smaller. That's fine. That's fine. All right. Okay. March 25, 2025 nursing updates. Okay. So for the month of February, we did not do too great with the flu. We had 173 cases of the flu in the town of Reading, and that was just reported through primary cares and hospitals. We are down for the month of February in 2025 in comparison to 2024 when it comes to COVID cases, but definitely not with flu. I do want to say that flu shots are still available for individuals 65 plus. If you feel like you would still want them, you can just go ahead and give me a call, and they are available. And moving on, I still do my blood pressure screenings throughout the month. We have one at Frank Tanner on the 20th, and that one is at 11 a.m. I'm sorry, 10 a.m. And then for April, Pleasant Street Senior Center on the 2nd of April, and that will be at 11 a.m. And then at Frank Tanner Drive on April 17th at 10 a.m. We have our very, very pleased to say that our 2020 on-site van is coming back for vision screenings. All slots have been filled at this time, which is amazing. And we really look forward to partnering with them again in the future because we filled those slots up, I think almost within a week a day. It was fast. They went like that. And on that same thread, we have the mammography van coming back to Reading on Tuesday, April 29th. This is in conjunction with Dana-Farber. This went live earlier this week. The Mammo van will be serving 40 plus community as well as individuals with referrals for a scan. The number on screen will take you to the registration link. Will take you to the registration voicemail line, or you can send an email. This will also be posted to our website, and I'm also happy to provide that registration link via email if anybody wants to just have it in their email. I will be hosting some hands-only CPR classes. We have one coming up next Thursday, March 20th. I think I have 11 out of 15 of those slots filled. So if you'd like to come, please go ahead and sign up. Use the QR code right there, or you can go ahead and give me a call or send me an email. We have another session on April 17th, which I believe has 3 more slots left. So feel free to sign up. A lot of families are signing up, which is great. The Pleasant Street Senior Center and Health will be holding a health fair at the Pleasant Street Senior Center on Tuesday, May 20th. It's going to be from 10 to 12. I am currently getting my vendor lists all satisfied, so it should be a great event. I want to draw back attention to our take back supplies programs. We have our diabetic supplies program as well as our medical supplies program. These have both been booming. I have gotten, I think about five or six different individuals who have brought in boxes weighing 10 to 20 pounds with medical supplies that I've been able to donate to different humane societies in the Reading area, which has really been wonderful. And then diabetic supplies that are being sent back for Insulin for Life for America. And they've been really appreciative of that. I've gotten some letters back from them. Okay, we are also going to be, for individuals who are unable to access local pharmacies such as the CVS in North Reading that need to dispose of medications, we are going to be looking into getting some med disposal bags that we can give out to residents that have accessibility barriers. So stay in tuned. We are looking into getting those, and that should be great. And that is the end of my presentation. Thank you.
Great,
Excellent. Thank you very much.
thank you.
Yeah, it's great. A lot going on. Good job.
Yeah.
All right, should I transition into mine next today?
Absolutely.
All right, let's do it. Let me just grab my, there we go. Okay. I don't know if everyone can see my screen.
Yes, we can.
Yep.
Okay, perfect. Let me just blow this up a little bit just so people can see it better. I color coded it this time, so to reflect current month and year to date. I just felt it broke up the numbers a little better. It was just more visually better on the eyes. So February, we got a little busy with inspections, which has been fun. I love going out in the fields. We issued 2 food permits, reoccurring food permits. They just kind of got lost when I was doing renewals. I was kind of solo just because we didn't have an admin, so it was a lot. So having Haley has been a huge help. It's taken a lot of relief off my shoulders when it comes to OpenGov. So we've kind of been able to go through, issue out permits that have just been lingering. So that is why you might see some of those. So they're nothing new. They've been there. So we've been able to get through those. I did 19 total routine inspections last month, totaling for 23 for the year so far. I had 1 single reinspection that I conducted, which, as we kind of mentioned earlier, a couple things that popped up. I gave the establishment a week just so they could get, plumbers in, technicians in. There was an issue with the warewashing machine and also a flip top unit. So kind of like how a day explained, I had them take all the food out of that flip top unit, store it in reach-in fridges and other flip top units. And then for the warewashing machine, unfortunately, they weren't able to use that. So they had to resort to their 3-bay sink to wash, rinse, and sanitize all of their equipment. Which is not fun when you're busy, but had to happen. And they were able to luckily get a plumber in within a day or 2. So that was rather resolved quickly. And then when I went out to reinspection, everything checked out great, looked great, got all the service reports and everything looked good. So hopefully they won't run into that issue again, or if they catch it in time, if it does pop up in the future. We got 3 general complaints for some food establishments, nothing major. I went out to all of those establishments, spoke with managers, owners, just reinstated some basic food safety, talked a little bit about maybe some sightings that people were seeing, and just general complaints again, all which were resolved and handled very appropriately by the establishments. I issued 3 temporary permits, those being for Winterfest that just happened last week, which I went out and inspected all of those temporary events and missed the rain by maybe 2 minutes. It did unfortunately start downpouring, which was so sad because it was really fun. It looked really fun. I wish I stayed, but at the same time was happy I did miss the rain a little bit. I did 2 routine body art inspections, so that counted all of our routine inspections for our body art establishments so far this year. I plan on going back in 6 months, which brings me out to, I want to say July or maybe August, September. Me and Ade talked about doing them twice a year instead of once a year. And I mentioned that to the establishments and they were very receptive to that. Told me I can come by anytime. So that was, really nice to see that they were rather excited to see me and, not excited to see me. We received one general complaint regarding, I guess a resident had an issue with birds defecating around her property a lot. And she was obviously concerned with the bird flu going around and whatnot. So as a department, we all kind of talked about it, hypothesized, what direction we could send her in. We don't really have an animal control officer. I know we utilize Wakefield, so that can be a little challenging when it comes to just standard complaints we get about wildlife. But we all talked about it as a group. We figured the best thing to do was to send her to the state health department, and maybe they could further assist her. So Haley very kindly called the resident back and guided her in that direction of addressing that issue with the state health department, and we haven't heard from her since. So fingers crossed that maybe the birds left her and her property alone. Very strange that had happened, but that did pop up. I went out with fire and building to a complaint we received regarding an older gentleman. A plumber went in to fix the heating on the house and just observed the house in some disarray, was concerned for their well-being. So I did go out with fire prevention, the building commissioner, and myself. We went out, we checked on the resident, talked to the resident. We are currently working with him and still are working with him along with the coalition as well in our hoarding task force. And that is just our hoarding task force is where building, fire, police, the coalition, we all come together and we just talk about situations that, residents are living in that might be dangerous or unsafe. And we just work around ways to providing them with a safe and healthy living environment. So that was that. And that sums up my monthly report for the month of February. So getting busy, which I enjoy. I love being in the field. So yeah, I think next month those numbers will be higher. So that's exciting. And yeah, that's pretty much it for the month of February. I don't know if anyone has any questions for me.
Well, thank you.
Thank you.
Excellent presentation. Thank you very much. All right. So from my side, the department is looking great. Good is an understatement. We're fully staffed. We have a great team. We work well together, and we are looking forward to a great public health future. So I'll hand it over to Dr. Lopez for the final comments.
Great. So any final comments from board members or I would just say that one is a day, if you can share the first couple minutes of our meeting, that clip with the police, and there may not be anything to do, but it was, very upsetting, and I think they ought to look into it, particularly if it's happening at other remote meetings. There may be some linkages or something. So I think they ought to be aware of this and perhaps investigate it. There was a name attached to that. The only other comment I have is that I'm on the State Board of Pharmacy, and they last week announced that I didn't realize this, but basically during the COVID pandemic, Governor Baker created the sort of emergency allowance for state municipal meetings to be able to be done remotely. And that sort of exception has kind of continued to be reaffirmed and reaffirmed since then. Apparently, it is due to expire March 31st of this month. And there is some discussion, we were told, in the legislature about, and maybe in the governor's office about furthering that, exception to the open meeting law. And so it is a little bit up in the air. Hopefully they will kind of reconfirm the exception for another period of time, but I just want to give everybody a heads up that, we might hear something different by the end of the month. And actually, if we don't, or if it's allowed to lapse, then our meeting in April, I would think would need to be in person. Of course, we will check with town council and our legislative people and see where that sits before we do that.
We would have to make name tags for the board members.
That would make it official, yeah. Okay, great. Good job, everyone. Some really good presentations. I appreciate it. I think the board appreciates it as well.
Great, thank you.
So I make a motion to adjourn the meeting. Do I have a second?
Second.
Okay, roll call. Joan,
Yes.
Kevin. Yes. Yes. Let the minutes say that Kevin has audio problems and he says yes. Okay, so we can leave. And Rick, yes. So thank you, everyone, and we will see you next month.
All right,
Thank
bye-bye.
you.
Bye.
Good night.
Good night.